Okay, good morning, ladies and gentlemen. Assalamu alaikum. Welcome to this interactive webinar discussion. I think we will make a start. If somebody can just give me a thumbs up that they can hear me, then that would be good. Thank you very much, Erin. That's really good of you. So before I do introductions and formalities, I think just in the interests of bandwidth, it would be, although it's wonderful to see so many familiar faces on the video screen, I think it'd be great if the non-speaking participants at this stage could switch their videos off, please, so that we've just got Erin, Amir and myself on the video. And then if you could all please keep your audios on mute, that will make for, I think, a comfortable listening experience. Of course, when we go to questions or observations from participants, we would be very happy for you to switch your video on, and we'll obviously need your audio on, but I think in the interests of smooth listening, we will just ask those who are speaking and participating in the main event to keep audio and video on. So thank you very much indeed, everybody, for joining. I'm really delighted to see so many friends and contacts of the British Deputy High Commission joining us for this interactive webinar discussion on ensuring customer and staff safety during the COVID-19 pandemic. I hope you all know that I'm Mike Nithavrianakis, the Deputy High Commissioner in Karachi and the Trade Director for Pakistan, though I am currently speaking to you from my UK home in Tavistock in West Devon, though hoping to get back to Pakistan for long. It's fantastic that so many of you have joined us, and thanks very much for taking the time to be with us. I know that most of us would like remote working to end sooner rather than later. Some industries and organisations are heading back to the office environment slowly but surely, whereas others have been restructuring their operations to continue essential services throughout. And of course, as we approach Eid, which we all hope will not cause a major spike in cases in Pakistan, and as many businesses prepare to head fully back to work in August, we thought it would be a prudent time to discuss with two leading multinational companies how they've dealt with the challenges, the risks and opportunities presented by the pandemic in ensuring the safety of their staff and their customers. So I'll introduce the two panelists shortly, but firstly, let me just run through the agenda and some brief housekeeping points. I've already asked people if they would just be kind enough to keep their audio on mute and their videos off, but please do switch them on when we get to Q&A and you are participating. I'm going to ask some questions of our two panelists and hopefully not put them through a media-like grilling, but we're hoping that some of these issues will be informative for you in your businesses, and some best practice might be shared, and hopefully during the discussion afterwards we will also pick up a number of tips and ideas. So we will be relatively brief in our answers so that we leave as much time as possible in the hour for Q&A and interventions by the many people on the line. There are a couple of people that I will probably go to first when we finish the sort of formal questions, but then I will hand over to my colleague Saif Khan, who's the economist in the UK network in Pakistan, to moderate that type of that part of the discussion. But for those of you who are familiar with Microsoft Teams, there is a chat bar which I hope everybody has access to. Please do make free and full use of the chat bar for comments, observations, and challenges as well. We would be very interested to hear your thoughts as we go through the questions and answers, and we won't summarise absolutely everything, but it will allow us to pick up some of the issues that you are raising when we do a debrief of this discussion. It's the first webinar during the pandemic that we've tried to run, so we'd be very grateful for any feedback that you can provide during the chat or afterwards. and any thoughts you've got about how the UK could perhaps convene other such discussions would be fantastic. The only thing, I've got a cup of tea, so forgive me if you see me sipping that, and I'm sorry that I'm not wearing a shirt and tie. I know that some of you are very smartly dressed, but I have a good excuse. It's that all of my shirts and ties are in Acton House in Karachi, and I have absolutely none here in Tavistock in Devon. And being Scottish, I decided not to go and buy one specially for today's webinar, so I hope you will forgive me. The only thing really that is missing, apart from me sitting in Karachi, is that I do not have any fresh mangoes for breakfast. So if there are any super fast logistic firm online, in the next hour, if you can deliver some fresh mangoes to Tavistock, Devon, I'd much appreciate that. So without further ado, let's get on to the main business. Our first panelist is Erim Shakir Rahim, who has been Vice President and General Manager of GSK Pakistan since March 2020. What a month to take over, Erim. She has over 25 years experience in the pharmaceutical sector, but began her career in the field of media, in advertising and as a journalist. Erim has extensive experience in South and Southeast Asia and has headed GSK's businesses in Malaysia, Indonesia and Bangladesh, and is GSK's first woman general manager from South Asia. GSK has been operating in Pakistan since 1951, so it will soon celebrate its 70th year. It's the country's largest pharmaceutical company with 13% market share by volume and 8% in dollar terms. They employ 2,400 people across their manufacturing, pharmaceutical and sales functions, and all three of GSK's factories are situated in or near Karachi. Many of you will be familiar with GSK medicines, Augmentin, Thyroxin, Sensodyne, Panadol, Calpol. The company plays a very big role in the nationwide immunisation programme against infant pneumonia and gastroenteritis, vaccinating millions of babies each year. Its products also cater to many patients with acute conditions, including those with respiratory diseases. Some killer facts: 5 GSK products are prescribed per second in Pakistan. That seems to me to be quite a lot. 1.2 million packs are sold per day. 2 packs of GSK product consumed by every Pakistani per year. So that's also a lot when you consider there are, what, 220 million Pakistanis. And on the engagement side, 94% of their employees say they are proud to work for GSK. Erim is ensuring that the other 6% answer yes to that question in the course of this year. So Erim, a very warm welcome to you today. So now to Amir Paracha, who has been Chairman and CEO of Unilever Pakistan since February 2020. He also joined a very important time. He has held various senior positions in Unilever Pakistan since 2000 and was most recently Vice President for Customer Development. Amir began his career at Shell, another Anglo-Dutch firm. He has championed inclusion across the firm in Pakistan, and it's recognised for its highly progressive diversity policies. Unilever, many of you will know, has been in Pakistan since 1948. It's one of the largest fast-moving consumer goods companies in Pakistan. Most of their production is local, 95% in fact, spread over 4 factories and 5 co-packers. They directly employ 2,000 people, but they have an ecosystem of third-party contractors and supply chain companies estimated at 21,000 employees. And since 2013, Unilever has invested $700 million in Pakistan through share purchases and capital expenditure, so one of the largest investors in the country. Unilever products are also household names: Lifebuoy soap, Wall's ice cream, Surf detergent, Lipton tea. My own personal favourite is Magnum ice cream. And some interesting facts about Unilever: they committed a sum of 500 million rupees to protect their employees and those of partners from any kind of layoffs or paid deduction during the pandemic and despite a decline in the economic activities. Lifebuoy and Domex have had a particularly high profile during the pandemic, given the need for increased hand washing and sanitisation. And 35% of all middle managers at Unilever are women, which I suspect is a ratio that compares very favourably to every other company in Pakistan. Let's hope Unilever can get that to 50% during Amir's tenure. So delighted, Erum, delighted, Amir, that both of you could join us. I'm struck that although both of you are experienced executive, you only took up your current positions a matter of weeks, and in your case, Erum, days before the pandemic arrived in Pakistan. So let me start, Amir, with you by asking, how working from home?
Okay, thank you, Mike, for the intro. Well, I will say, taking over in February, which is practically a month before the virus actually hit the country, I feel like being baptized by virus. And I think so that's what's been the story of the last 4 months. Um, to your first question regarding how we have been coping with this entire virus over the last 3-4 months is uh, we have actually, like many other companies, have actually now put in a lot of safety protocols. And I think so we have also have a tiered response safety protocol that we've actually put in place, which are comprising of around 4 tier systems, which goes from tier 1 being the lowest, which means there's no virus case, all the way to tier 4, where basically you have a very high rate of human transmission. And we have actually, been observing the tier 4 protocol in our country, be across our head office, be it across our factories, across our co-packers, and across our supply chain. And there are different basically protocols being applied. Be it's the interest protocol, which now most of the organizations have applied. It's around thermal screening. It's around social distancing. It's around all those disinfecting of the areas. Then there are employee transportation protocols that we have actually put in place. That's been pretty rigorous because we have made sure that none of our employees travel in a commercial vehicle. Primarily, a lot of workers that come to factory travel in commercial vehicle. So we have actually banned all commercial vehicles, and we have now introduced our own vehicle, providing them pick and drop, and that too with half the capacity. And each and every seat is being marked. So we are kind of observing the safety protocols to that area. Likewise, any truck that basically enters into our factory are also have to go through the complete disinfectation process. The driver has to remain in the truck and not allowed to really step out. Likewise, common area protocols are very strict. There are limited change rooms. We basically marshal all the marking in 2-meter distances. We actually are ensuring that all the lockers are properly reshuffled. The number of chairs have been reduced. All the desks have been marked. All the productions have been actually divided into zones. No one are allowed to basically move from one zone to another. And if he or she moves from one production zone to another, the person has to basically make a proper declaration that he or she has actually moved from one to another area. So, these kind of many such protocols that we have actually been applied around Beats cafeteria and prayer area, cleaning and sanitization, and we have a rapid emergency response and audit. To be honest, we continue to learn every single day. And I think so I'm equally looking forward from the panel, from people all around, if they have some best practices to share, and be happy to basically share any best practices that Unilever has actually applied. Coming to your last question, which is basically working from home, we have around, Unilever Pakistan happened to be the first company announced the work from home, which was 15th of March, even prior when the government of Pakistan, have announced that from 22nd of March. Many people actually made fun of us that we are being actually, reacting too early in the stage. And many people have turned back that, listen, enjoy your vacations at home. And I think so, lo and behold, within a week's time, the country then basically imposed the backdown. So on a very second day of 15th of March, which been the global call, our CEO Alan Jope have taken that all the offices are going to be shut down and everyone's going to be operating from home. In Unilever, 600 people have actually started working from home from 16th of March till now. And I think so the experience has been fabulous. I think the MS team has been brilliant. The technology has surprisingly kind of really supported us very well. The first 1 month was a bit challenging because people are trying to really balance their personal lives with professional life. The biggest challenge I think so was faced by the working mothers, because that's where they have to really basically, balance between their domestic and the professional life. But I think so with time, we have managed to really kind of learnt the way. It's been 4 months. Unilever globally basically carried out a survey that how many people wanting to come back and work full time. It's 8% actually, to be exact, that who wanting to basically come back to office and really work full time. But I think so. Unilever globally have 180 or operating 180 countries. We have a very strict protocol to reopen the office. Only by now 35 countries are allowed to open the office. So we have to apply to the global incident management team to seek permission. And and I can get to what exactly protocols look like. But it's been a great experience. We are trying to really ease. We did one thing, and I would really recommend others as well. 3 months back, where we basically ran a campaign that are you missing your chair, your office chair, because we realized that many people basically are operating from their dining chairs or from other. So we have actually basically sent 200 chairs to people home. We delivered at their houses so they can at least have a comfortable working chair to really work with. So that's what we have been.
That's really good to hear. Sorry to interrupt, but if I don't interrupt you, you're going to answer all my questions in the first go, and I'll have none left to ask you. But that's really interesting to hear. Firstly, about Unilever's very stringent and probably gold standard protocols that you've had in place, which has allowed your operations to continue largely unaffected, although I realise it's required a lot of learning and development and change along the way. And then also, yes, it is striking about the home working, which I think we're going to come on to in a bit more detail. So I'll pause there. But that figure of 8% only wanting to come back in a full-time capacity is really striking. And I guess other companies would be wise to do a similar survey. So look, Adam, let me ask you, GSK has been operating for much of the lockdown period because you were regarded as being in the area of essential services and providing obviously essential goods. And UK multinationals like Unilever, like GSK, have always led by example. How is your company ensuring staff safety in your production facilities, particularly?
So thank you very much, Mike, and I think thank you very much for the very interesting introduction. GSK, but again, just on a personal note, I actually landed in this role right in the middle of the pandemic, in the sense that I was probably on the last flight that landed in Pakistan before I took over the role. So as far as I'm concerned, I have not met my team. I've not been to the office except one day. So I'm trying to get to know the team because I've been away for a long time. So all my introductions and work with the team has been through digital media so far. So that again itself is an interesting experience. But coming back to the question about we've approached the situation on ground in Pakistan. So globally, what we have is basically some of it is very similar to what Amar just mentioned. The alert statuses, and that's something that we can continue monitoring. One of the things that we have from global is the framework of how we approach COVID, and the decisions are generally local, but the framework is the global framework, which has three components. First is people, second is business continuity, and third is support, meaning support to the community and also support through the products that we have in terms of science and development and vaccines and that's area. So using that, what we started, I think, and we went into work from home mode for most of our office staff from the 17th of March, I think. But the first thing that we did was we started an issue management team. We put in place an issue management team with senior leaders across the organization, because everybody was learning, and as Amir said, every day it's a new learning. and we needed to make sure that we are all on the same page, but also can make very quick decisions if required. And I think that really helped, because what happened was, first and foremost was people safety, and on the business continuity front, because we are in a essential healthcare space, we had to ensure that our medicines were available, our logistics were working, our supply chain was working. And I think that was the first test of our resilience, because when the initial lockdowns happened, they were not lockdown declared by the federal government. It was, every region, every drug inspector, every chief minister saying something different, and we needed to make sure that our not only were our people able to freely come to the workplaces, but also our products were equally being able to supply it. So I think a lot of work with the help of our CGA team, but and looking at it, and being really closely monitoring that situation and resolving that situation. So agility was required. We've got 3 sites in Karachi, in different areas of Karachi, and all have been fully operational. And I think at least one site has been 24/7, just ensuring that the essential medicines don't disappear from the marketplace, and doctors and patients have access when they need it most. And to be able to do that, first we needed to ensure and reassure our teams, people working and coming to the offices, that we were focusing on their safety as much as we were focusing on anybody else. So making sure the protocols were in place, ensuring segregation, ensuring PPEs, ensuring screening, ensuring giving them also flexibility, that if they are older employees or they have comorbidities, in fact, we ask them not to come, because even if they were essential, we realized that the exposure and the risk for them was the highest. So I mean, just ensuring a lot of engagement, but also putting all the protocols in place and being very disciplined about it. Common spaces, people flow, uh, changing rooms, kitchens. Again, we realized that two big areas were kitchen and changing rooms. So in cafeteria, where people were having food together, just making sure that we were able to maintain that level of distance. On lines, we actually reduced our numbers of people coming in, and it was only the essential people who were required to come in. Even in the factories, so we really reduced that, and the same protocols for transportation, for instance. So we ensured that there was nobody was using public transport. We enhanced the number of vans. We ensured that in the vans occupancy was 1/3, and we kept learning and improving on situations, and disinfecting the vehicles coming into the office, making sure that the distances were being maintained. The other part was also about not just disinfectation, but also tracking absenteeism, because especially people on the line, when people are not there, just checking in and making sure that it was okay, and if in case they were exposed, then helping them, supporting them, guiding them on the protocols for COVID, but how to get, where to go, how to go, because initially there was a lot of confusion in that space. So supporting that, and doing a lot of training, and constant training, and training, in English, in Urdu, but also training in some cases for the families, because one of the things that we learned, and we realized over a period of time, was that we were maintaining very high levels of protocols in the office, in the factory space. But what was happening is, once they were going home, they were interacting with everybody, and they had family members interacting with everybody, and there's a higher risk of getting the infection. So ensuring the families was also trained in terms of how to maintain safe distancing, what is required, just making sure, so that it's we could protect the employees, but also their families. So it was generally a high commitment to people and their safety in that space.
Eram, thank you very much. Look, sorry to interrupt, because I know we want to cover some other questions, and I think just 2 observations on what you were saying. I mean, firstly, the fact that you got into Karachi on the last flight and have only been to the office on one day, and have had some struggles having face-to-face meetings with your senior team and the rest of your managers. I think it speaks volumes of how challenging it has been for all of us, but particularly for those who are not necessarily new to a country, but new to a role in that country. So, well done to you and your team for being able to navigate that so effectively and professionally. And then, interesting what you were saying about the different messaging. I mean, every country has had a challenge around the consistency of communications, and particularly on behaviour change, what to say about social distancing, what to say about hand washing and sanitisation. The differences that might happen in a country like Pakistan, where you have a provincial government one party's shade and a federal government of another's, and the messaging there has some challenges. Even in the United Kingdom, where we've got the Union of Scotland, Wales, Northern Ireland, and England, that has also caused some challenges. But I think the important thing is when you are trying to adhere to the most stringent standards, you try and make that consistent across the board and maintain that consistency of message. Really helpful. Let me ask you both now about the office-based environment, because you've touched obviously helpfully on your factories and manufacturing plants and the protocols that were put in place. I mean, what are you doing to ensure staff safety once you head back to the office, and what stage of that process are you at? Why don't you start, Erum, and then we'll go to Amir.
Okay, so I think we have to, one is the head office employees, but we have a very large sales team. So our sales team actually is also working from home at this point in time. And so if when we discuss in the our IMT, our first priority is to ensure that our sales team can go back and work face to face, because they're doing all remote or meetings or remote discussions with our HCPs. So on that, we have to have a very strong risk management process in terms of seeing what are the sort of risks that they can face, but also again going back on trainings in terms of how do they enter a medical clinic, for instance. How do they keep the distance? Because I mean, some of these clinics are very high risk. So making sure that we have high risk areas mapped out, high risk clinics mapped out, but a lot of empowerment and agility for people on the ground, so they don't have to come back to us for every decision. We're also making sure that we have surveys in place, which we are doing on a weekly basis, just to check and assess what is their level of anxiety. And there are people who may not want to come back because they don't feel comfortable, or they have people who are more susceptible at home, or they themselves are susceptible. So I'm giving them that space. So we are quite fairly ahead in that process. We are waiting to see what this spike is, if there is any spike after Eid, and try and come back face to face for the sales team somewhere in August, first piloting in a few areas which are green, and then taking it across other cities wherever it opens, but also keeping the flexibility of not giving a guidance for the rest of the year. We are going to do a weekly review and see, okay, so do we need, do we continue that, or do we now not continue? And we've learned from many countries. So we've learned from Vietnam, from India, where things had improved, on Turkey, and some places we had to stop. So the restart is something that we have to constantly be aware of, and make our team also understand that this is how it's going to be. So don't expect very long-term directions. We will have to be more agile and more flexible. On the head office front, what I think is the general, we are not in a hurry to go back until unless there is a specific requirement. There are teams where we really need to work together, or there are equipment or files or data that we need which cannot be accessed remotely. Then these are people that we that go back through a process. But even if the lockdown eases to a greater extent, we will not go above a certain threshold of around 30% people, because what we have to do is make sure, and we've started, and it's, I think, fairly advanced on that, is marking seats, marking office space, but also ventilation, ensuring that we've got the right sort of HVAC in the offices, so that the viruses are not spreading. So all these things need to be put in place, the screening protocols, but as far as I see it, we don't think we'll have a full resumption of office till the end of the year. We are probably going to be a blend of office and working from home, where office is strictly required. Then people would go under and follow the strictest of protocols.
Great, Erum, thank you very much. Amir, you've got only 8% of your employees wanting to go back to the office. So what's it going to be like when you've only got 8% of them there?
I'll comment on this after Amir, because we have a different data point.
I think you're still on mute, Amir.
That's global figure, like 8%. That's not a Pakistan figure. I don't know how many people in Pakistan. As a matter of fact, what I get to hear is a lot of people wanting to go back. I think so. They're getting frustrated back at home. Just to give you a perspective, around 21,000 people in our ecosystem, who are directly us, or we're being employed by our distributors and by our third-party workers. Out of these 21,000 people, whilst we say we are basically working from home, 20,000 people continue to basically work from their own premises from March to date, because people who have been coming to factories, they've been coming and they've come actually every single day since March till now. Or be it the sales guys, they have been going to the market every single day. Yes, I think so. We have changed the protocol that you got to be going to the market at a time where there's a low traffic. You got to be going to the market with goggles and face masks and hand sanitizers. So we are sending them to the market with the right protocols, and so as the people going to the factories with the right protocol. But as a matter of fact, out of 21,000 people, 20,000 people continue to actually go to their previous jobs as is. It's actually the head office people, which are 600 number, who have been working from home since mid-March till now. I think the way Unilever works, actually, Unilever is basically looking at three metrics. They're looking at WHO data. They're looking at the local country data. And they are basically looking at what the government is basically announcing. They look at these three data, and there are three metrics. One is the internal metric, that how are the number of cases within Unilever in terms of the people who are, who are reporting any kind of cases, or who are basically positive cases. Then they look at the external data in terms of is the graph going up, graph going down, number of empty beds available at the hospital, number of ventilators available at the hospital. They look at the transmission rate. They look at the number. What's the positive rate? It has already fallen down from 20 to yesterday it was 5.6. The number of already fallen down from a high of 6,800 to down to 1,013 yesterday. So Unilever look at all these metrics, and then they basically, give you the permission whether you can actually open the office or not. Once you get the permission, then it's 21 days that you need to prepare the office. And when I say the preparation of the office, this means we are now working toward making places touchless. For example, we are converting our touch doors to to automated walk-through doors. We are basically converting our doors, which to be opened through paddles, through through your foot rather than your hand. We are basically taking out all the unnecessary seats. Only 25% of the total population will be allowed to stay on one floor. So it's going to be a staggered approach when we basically open. Once any person who opts to come to office is going to get a chance, maximum 2 times or 3 times to back to office. So to be honest, I think so within Unilever, people wanting to go back to office, we are looking at basically opening somewhere mid of August if things continue to stay in control post-Eid. But I think so all our preparation within the office is being completed. We have done all the markings. We have basically taken out all the extra chairs. As basically Aram is mentioning about HVAC, if a standard HVAC has 10% of the fresh air coming in and 90% is recirculated one. What we are doing is we are going to be basically changing the proportion from to 50-50. So 50% is going to be fresh air, 50% going to be recirculated. It's going to take your energy cost high, but actually it will reduce the vulnerability. Likewise, all our offices are actually are closed. We have now basically created separate vent windows across all our offices. This work is being done, and every 3 hours we have to basically every room has to open the vent. So over the last 2 months, we have actually prepared our office that whenever we basically have the permission, the 25% of our population can go and attend the office in a very safe and controlled environment.
That's really helpful, Amir. Arum, thank you very much. I mean, just to hear your individual experiences, I think is really useful, where there's obviously common areas of protocol, but issues that are also specific to the company, but to the culture of the company internationally, but also within Pakistan. I mean, for example, the Deputy High Commissioner in Karachi, nobody's going into the office at the moment on our compound in Clifton. People are going onto the compound, but nobody's actually going into the office building where normally 30 or so of us would work. But those 30 people are all on laptops using Microsoft Teams, and I'm in touch with them on a daily basis. In some cases, I have more contact now than I did when I was gallivanting around the city of Karachi from appointment to appointment. So there are sometimes positive sides to it, although I must confess the novelty of constant Zoom and Teams meetings is starting to wear off for me at least, and a change of scene would be nice. So I do hope that there isn't a spike in cases after Eid, and that we can, I know that we won't be returning to normal, but at least start to do a bit more face-to-face interaction. So that's really helpful. Look, I want to ask you one last question, and then I'm conscious of time because I would like to try and get some inputs from a couple of other colleagues and then go to open the floor to questions. So please, friends, do put some questions in the chat bar. I can see that Reshma has asked a very important one about well-being and mental health, which is partly what I'd like to finish by asking both of you about. Obviously, diversity and inclusion is important to GSK and Unilever, and I think that's a strength of your companies, if I may say so. Having a diverse workforce also, however, brings challenges during a crisis, and somebody mentioned earlier on the difficulty, particularly for women, of juggling childcare and the office. Many people have other caring responsibilities for elderly. What are you doing to sort of think about some of those issues as you move back to the office, and indeed as you support colleagues who do want to stay working at home or want to have a more flexible work-life balance? I mean, are you looking hard at some radical things? And maybe you could be quite brief in your answers, if that's all right. Shall I start with you, Amir?
Yeah, sure. So the approach Unilever globally is taking, that it has a very flexible approach. So when the office opens, it's purely the call of the individual. If the person is feeling comfortable working from home, he or she can continue working from home across 5 days of the week. And if the person wants to basically work from office, he or she is basically more than welcome to come to office and operate from office, albeit it's going to be not more than 25% of the population allowed at one given point in time. And if someone basically wants to follow a very hybrid model, which is practically working from home and on premise, it's purely up to the individual. Many people have actually moved back to their hometowns. Some people belong to Lahore and Islamabad, and they're very happy, working from their home. And to be honest, we haven't seen any dip in the productivity. These people are allowed to basically stay back, at least to the end of the year, or till we have the vaccine, where we have 100% confident that, the things are in control. Because as Iram was also mentioned, there's going to be, we don't know, what happens. For example, lately, there's been an upsurge of cases in Hong Kong for the last 2 weeks of 500. And again, they're basically putting a ban on the cafes, and everything is going back to lockdown. So we don't know that Pakistan may get into a similar situation, say a month or two down the lane. So everything is very volatile. Everything is very flowy. Things basically changing on a daily or a weekly basis. But we have a very flexible approach towards our employees, and we leave it to them whatever the approach they want to take.
That's really helpful, Amir, to hear that flexibility. And I think a lot of organisations are looking at trying to, because there has been some positive productivity issues around the period during lockdown, I think organisations are much more open to that than they would have been, not just because of COVID-19, but because they can see that it produces that. Although I know that it's a mixed experience. I mean, some people who have been trying to juggle caring responsibilities for the elderly, childcare responsibilities, where of course there's a very mixed experience on online learning, and trying to juggle work for that usually is a burden that falls more on the woman than on the man. And so, some women would like to get back to the office environment to be able to give a recalibration of that balance. So that's really helpful. I noticed that you said, of course, flare-ups in places like Hong Kong, Melbourne, Iran next door to Pakistan, yeah. States in the south of the United States. We're all, worried about second spikes or further waves, and obviously a vaccine is receiving a lot of attention. So there you are, Iram. GSK needs to find a vaccine very soon. What can you just say very briefly about that area of supporting your staff in the home environment and the work-life balance?
Okay, so I think first the question that Reshma asked, that mental health is very, very important, because it is stressful, right? We're not used to it, and all said and done, when we go to the office, we do get some breaks working with Zoom and through digital media. And we see a lot of time people are facing now. They're facing quite stressed. They're very stressed, and we've had people with issues in the family. So we have the employee assistance program where they can talk to trained psychologists, a abroad, but also locally. And we've tried to keep, reinforcing that sort of message and support through online presence in Pakistan, through webinars. And so I think that's the service that's available to our employees. On the women's front, actually, frankly, GSK is a modern employer, which our focus is inclusion and diversity. So a lot of our policies are already supportive of this. But in this specific scenario, it is very, very flexible. And in the sense that if you have prioritization in some to prioritize your somebody at home who's unwell, then by all means. So I think the culture is such that you just need to make sure that you're informing your line manager, and that's about it. So I don't think there's no rigorous ask of that you have to dial in at this point in time or end at this point in time. It's very, very flexible, and I think the feedback so far is very positive, and we've been constantly checking in. The other thing I think we see is also that here, because of extended families, in some ways it's easier in other countries where they need a lot more child support, if especially then we're looking at it and supporting that from that angle. But in Pakistan, so far the feedback, and I wish we had matrices like Amir. Our ratio of women in our employment is around 18%, and I think they're very well supported. This and not just women, but I think everybody. I mean, it can be the males also. So making sure that they feel supported, and we come across as one family, and it's just like the GSK family. And I think that level of trust and connectedness is very much there, and I think that's what is helping us.
Great. Amir, thank you very much for those answers. Really helpful to hear just how flexible both of your organisations are being. So look, you will notice that there are questions flowing and comments flowing in the chat bar, some really good ones, and some ones specifically for Unilever and GSK, which if there's time at the end, we'll try and pick up, although I don't know whether you are able to type in any answers to those, but we'll pick them up somehow. If not in the next 17 minutes, then we'll do that afterwards. But thank you very much indeed. Please stay on the line because we will probably come back to you. But what I'd like to do now is turn to Harun Rashid, who is the Managing Director of Shell in Pakistan and also the President of OICCI for the rest of this calendar year, another big Anglo-Dutch company that we in the British Deputy High Commission and in the Trade Department work closely with. So Harun, if you are still online, and I can see you're putting your video on now. Oh, you are in a lovely office environment, or either that or you've got an oak panelled room in your house. But good to see you, Harun. So, I mean, you've been listening to what Amir and Arun have said. Is there anything you would like to say either about how Shell has pivoted to handle the pandemic from an operational point of view, staff safety, customer safety, or indeed some of these important issues that we've touched on in terms of engagement with staff over their work for Shell, whether they're at the headquarters in the central office or elsewhere? Give us your perspective, please.
Thank you, Mike. Given time, I'll kind of try to stay very brief.
Please do.
A lot of what Amir and Iram said, sounds very familiar. So, in a sense, we are acting quite similarly. A couple of things where we are different, and I'd like to kind of say that here, that might help, is on our return to site program, we are looking at least I am looking at 3 weeks after Eid to reassess the situation and then start the reopening of the office process. The reason I say 3 weeks after Eid is because medically, if there is a second wave, 3 weeks after Eid is the time when it will be at its peak. And there might well be a second wave. When we had a first wave, it was quite tough. Hospital beds ran out, etc. And you just don't want to take risks in a tough environment. So 3 weeks after Eid is kind of a key milestone for myself. Then the other thing I've noticed is that the operational environment, our depots, our blending plants, etc., which we have had to keep open, our colleagues are very used to lots of discipline in terms of how they act because of the sensitivity of the products we handle. Fuels can be very nasty if not handled properly. And as a result of that, whilst they were open, we found we were able to manage the situation in a way that our staff is not put through too much risk. The number of cases reported in our operational sites is about the same as the number of cases in staff reported working from home. So that's about the same. And but that does not mean you can de-link the two. The two are very much linked, but the risk is higher in an office environment. That's my second additional point in terms of what I've been hearing. Then the last additional point for the consideration of our colleagues on the call is that as we go through this pandemic, there is a tendency to take things lightly. And in terms of staff engagement, in terms of sharing, because people are at least our team is now tired of sitting at home for 4 months. Everyone wants to see each other. The discipline of allowing less than 2% people in our head office or in our offices where people don't have to come, it was quite okay to implement or quite easy to implement up front. Now I'm struggling, and I'm really having to put out some communication town halls to ensure people don't show up. I allow people to come in by exception. For instance, in Karachi, we have joint families, and for some people, their home was just not safe enough, or there are just too many people. They wanted to come to office. And we have allowed by exception, but we have tried to maintain the number below 2%. But that is a very difficult discipline to maintain as time flies. So that's my third additional point. The rest I would not talk about given the time constraint. But
Arun, look, thank you very much. Really helpful indeed. And I strongly agree with you that we are going to be living with COVID-19 for a long time to come, whether it's months that might even roll into years. Who knows about the success or otherwise of a vaccine? And whilst the kind of low and slow trajectory of the virus in Pakistan in comparison to other countries, and indeed other countries in the region, has been welcome, but we all recognised how much pressure the healthcare system was under when the cases were at their peak, probably late May, early June, that period after Ramzan. So I think you're absolutely right to be cautious and to monitor things very carefully before, during and after Eid. Really good to get that perspective. I just want to come now to Kashan Hassan, the boss of Reckitt Benckiser in Pakistan. I'm really pleased that we've got so many of the biggest multinationals, British multinationals in Pakistan who are on the line. Kashan, in literally 2 minutes, if you wouldn't mind, could you maybe just give us your perspective on any of these subjects, whether it's specifically about staff engagement over their well-being, the hybrid model, or whether it's specifically your operation as a big diversified company in Pakistan? What's the process been like for you? I know that 2 minutes is not very long, but please give us your thoughts.
Thank you, Mike. Good afternoon and Assalamu alaikum to everyone. I think a lot of the things that I agree with Harun, a lot of the things that I've heard today are applicable to us as well. So it's in a way it's encouraging in difficult times that people, both that our thinking is similar to what others are doing, as well as the fact that we all share the same issues. I think. For us, my last day at work in the office was 13th of March. So it's been 4 months and 10 days now that our head office is closed. Of course, with our range of disinfection and anti-bac products, our factories, our warehouses, our supply chain has been working overtime. So keeping them safe has been a big priority for us for these last 4 months, where we have taken exactly the kind of whether it is checking everybody coming into the factory. Social distancing on a factory line is not easy to do, especially when you are trying to multiply the kind of cases you make on Dettol, antiseptic liquid, as well as surface cleaners and soaps and so on and so forth. So it's been a challenge from that perspective, but I agree. I think in terms of coming back, just to say quickly, I think we are reviewing 2 weeks after Eid, mid of August. We've planned a leadership team meeting to assess the situation. I do believe that it's not like there is life after Corona. There was life before Corona, and now I think we live in a world with COVID-19. So we have to accept that we have to try to get to some kind of a new normal sooner rather than later, because nobody can tell us now that you wait till October and it goes away. So I think we have to live with and we're ready from an office perspective. We have to be ready from a people perspective as well, from a behaviors perspective. And from what I'm just sort of talking to people, from what I understand, roughly about 30% of our team is quite keen to come back to work. The rest are probably not. And whenever we do, we'll do it giving people an option to say that if you feel uncomfortable, obviously certain age groups, more than 50 women, pregnant women, anyway will not be allowed, but those who will also be given a choice if they don't want to and want to continue to work from home, which I believe, frankly, has been quite productive for us in these last few months.
Kashan, thank you very much. Really helpful. It's interesting that you talked about before coronavirus. Our High Commissioner describes it as BC and AC, so before coronavirus and after coronavirus. And I personally don't like using the phrase the new normal, because I hope that this is not going to be how life will be forevermore. There will be an after coronavirus. We just don't know when that will return quite yet. So really helpful to get RB's views. Look, we've got 10 minutes left or so, and I know there are quite a few questions in the chat, but I don't know if Erum and Amir have been able to read them. But let me hand over to Saif now to perhaps come up with a couple of questions that he can put you on things like productivity and safety. So over to Saif Khan, who's my colleague and the Deputy High Commissioner in Karachi, for you to moderate the next few minutes before I close the session.
Thanks, Mike. So we've got sort of 2 or 3 themes in terms of the questions. So let's go over the human resources and productivity questions. Broadly, they're around what is the impact of this virus on job security? How are these companies measuring productivity? What are the skills that are going to be most in demand? And if I may add, does this mean that firms will be looking at digital sales as opposed to actual physical sales?
You want to go first?
Yeah, go ahead, Amir. Go ahead.
So I think so. Yeah, you want to go?
Yes, please go ahead.
Okay. So I think so. The productivity, as I think so everyone is stating, the productivity has certainly shot up during these times where people are working from home, as they are really basically have not much of a social life, and they're practically working throughout the day via MS Teams or Zoom or whichever basically app they are using. In order to measure the productivity, I think so in the current days and days to come, what is going to be critical is agility. You've got to be extremely agile. You've got to be practically on the go. You've got to be basically on the move and really basically figuring it out what's the best way to actually move. So I think digitization has really kind of taken a leap. I think so. What has companies have digitized in the last 4 months, which they weren't able to actually digitize in the last 4 years, by the way. And I think that's going to be the key competency required as we go forward. For example, I'll give you an idea. For example, every day our salesmen go to a shop to take the order from a shopkeeper. Today, and we were trying to basically get a app downloaded that a retailer can actually place an order without a man going there. And we have only 1,000 downloads. And as of now, in the last 4 months, we have 20,000 downloads. So 20,000 retailers are actually placing order live through the app without a person going out there. So I think the e-commerce, likewise, a sales generally have actually shot up, by 5 times to 10 times for most of the organizations. So I think so the key skill that we are, and likewise, it's not only for the grocery business, also for the business and textile industry, people are more comfortable really placing the order online and getting the product delivered. So I think so the key skill that's required in the days to come is around digitization, and many companies are actually digitally wiring themselves. As far as finally your question around the livelihood of people, which is around the job security, it is certainly is a big $1 million question everyone in the world is asking. If I were to talk about Unilever or particularly the CPG industry, which is consumer products company, we happen to be all-weather company. We are lucky to be operating in a category called essentials category, and most of our products happen to be very much used. I think so. Unfortunately, the industries which are being impacted are textile, white goods industry, because people are certainly preparing for a recession. The world is preparing for the recession. So livelihood is certainly going to be a challenge for most of the industries as we go forward.
Very interesting, Amir. I mean, there's an old adage, I think, from a politician many years ago about never let a crisis go to waste. There are always opportunities that come from a crisis. So the way that you've pivoted towards supporting the digital online e-commerce opportunities is really very interesting. And yes, I realise that GSK and Unilever are not standard in terms of the ability that they can provide their employees over job security in the way that some others. You look at the challenges that daily wage earners in Pakistan have faced in the last few months and are likely to face for a considerable period of time, and it's very worrying indeed. Erum, anything you want to say very briefly before we go back to the chat bar?
I think very similar to what Amir is saying in terms of in the healthcare space. So one aspect is the logistics and the order taking and trying to be as digitally savvy in that. Our other big spaces are interaction with our doctors, because our mode of communication is through our sales reps, and it's very much face to face. So I think over the last 3-4 months, these the way we've been able to accelerate our digitalization has been what we couldn't do in the last 10 years. So I think that has really changed. Is it as impactful? Possibly not. So we have to continue looking for alternate channels, but also look at content, because obviously our customer time is equally important. So and every single country, so company like 700 companies doing the same thing, giving the same level of information, would not differentiate you. So we really need to know the channels, but also the preference of the doctors, but the content that we're providing, and is it really adding value or not. So we have to be much more mindful of that. There's also a very big initiative that we see is on telemedicine, where doctors are now consulting through apps, or through phone, or through Zoom. I think that trend would continue. I think in Pakistan, maybe not become the main scheme driver, but at some point in time, it will be much more critical than what it is now. So I think that is important. Head office productivity is much higher, but obviously there is always a risk of burnout if we don't give space to people. The sales productivity, I think, has gone down because if we were doing 15 calls in a day, now we're looking at 4 calls, and also to only people who have given us consent to call them. So that I think are the differences that we see.
Great, thank you so much, Erum. So Saif, back to you. I know there are more questions and comments. I'm for some reason unable to reply to them or click on them. It's perhaps because I'm a guest, but we are reading them and appreciating them. And if we don't answer them in the next few minutes, we will take them away and come back to you. So Saif, any one last round of comments or questions that you would like to give Amir Erum?
Yes, Mike, there's been a question around, so there's still some confusion in terms of how does the virus survive on product services? So the question was, does it not? And what would these panelists recommend as best practices in terms of if you're going shopping or doing groceries or in our house, how do we stay safe? Would they recommend any product that we can use?
Yes, Amir, you're going to recommend that they only buy Unilever products, I assume. Why don't you have a go? Why don't you have a go at that question?
Ashan is there from record, so I'll be careful. Well, I think so. What we have been taught, I think so. Use a product which has a hypochlorite in it, because that's and I'm not going to be recommending a brand anywhere, but I think so. Hypochlorite is the one which is the most effective to actually kill this kind of the COVID streak. So I think so. That's my only recommendation. As per our global doctors, yes, it does basically stay on the surface. It has a different life on a plastic, different life on a metal. It has a different life on a paper. So it varies in number of hours, but yes, it does stay. And I think so. The best way is to basically use sanitization, or the best way is basically you continue washing your hand, because there's no better cure to kill virus than basically washing your hands.
Yeah,
Erum,
I think. I think basically the basic hygiene and the basic guidance from WHO. Make sure that you wash your hands, don't touch your face, wear a face mask if you're in a closed space, and also maintain social distancing. I think that's the most critical, and stay with that. The virus is very unpredictable and it's mutating so fast. So I mean, it's very difficult to say what would help or what would not help. I think that's the guidance that we have.
I'm going to bring things to a close because it's now 1 o'clock in Pakistan. So forgive me if we have not answered your question, but we have got them all captured in the chat bar, and we will endeavour to come back to you either direct or through Unilever or GSK. But look, I just want to say thank you very much, Amir Arum, for an incredibly insightful session. I'm sure that a lot of what you said, friends who are on the line will have found interesting, and in some cases it's common sense, but it's good to hear it articulated in a way that they can understand for their own environments, their own businesses, and their own work-life balance. So I think there are some really interesting options for us to take the conversation into a more detailed way. I suspect we could have spent the whole hour just talking about staff engagement and the work-life balance and well-being and mental health, and that may well be something that we would like to come back to. Please do give us your feedback. We'd be very keen. Criticism, constructive criticism is also welcome. Any thoughts about other webinars that we could do, we would be really pleased to do that. I know that I saw that Ehsan from PBC was on the line. We had Haroon from OICCI. We would love to work with those organisations and their member companies to see whether we could do more of these sorts of things. Thank you very much, Arum, Amir, for your willingness to participate and for being so open and candid. Thank you too to the audience. We had, I think, at one point more than 60 people online, and without you, this would not have been possible. And many thanks indeed to my team for helping stage this. The teams at Unilever and GSK as well, but Saif, Sumera, Wendy, Olivia, Asif, and others on my side. Really appreciate that. So we will sign off now. Please look out for some posts on social media, which we hope that you can retweet or like. Give us some reviews on what you thought of this. We will do another event very soon. In the meantime, stay safe, stay sane, and stay connected. All the very best. Bye-bye.
Thank you, Mike. Thanks a lot. Thank you, everyone.
Thank you very much, Mike. Thank you, everyone. Bye-bye. Bye, Amir. Thank you very much.
Bye-bye.
Bye.